Assalamu alaikum friends. My name is Sayyid Hassan Ali and today we're going to discuss a very important topic which is antibiotics and their classification. So before we come to the point to discuss antibiotic classification and mechanism, we will first discuss what is antibiotic. So mostly people have a suggestion that these are the drugs that is used to treat all types of infection. It's not actually the point. The point is the antibiotics is only specific against bacterial infections and some protozoal infections. It is not effective against viral infections like cold, flu. Antiviral drugs are available for viral infections. So what is antibiotic? Antibiotic is a type of antimicrobial substance active against bacteria. Antimicrobial substances may be obtained from microorganisms. These antimicrobial substances can be obtained from microorganisms like fungi. If we discuss about fungi, we will come to know that in 1928, Alexander Fleming, discovered penicillin from a fungus which has a name, most probably Chrysogenum. Penicillium chrysogenum. This is the fungi through which Alexander Fleming obtained penicillin in 1928. So antimicrobial substances are obtained from living organisms which are maybe microorganisms like fungi. So antibiotic is a type of antimicrobial substance that is active against bacteria. Also they show antiprotozoal activity, but not effective against viral infections like cold, flu. These are the viral infections and an antibiotic cannot treat it. So now we come to the point to discuss about antibiotic classification and mechanism. General mechanism we will discuss here, but as you can see, I did not mention cephalosporin generations and fluoroquinolone generation because students have a very difficult they have many problem in understanding the generations and classification of cephalosporin and fluoroquinolones. They always forget about some exception cases. So through mnemonics, we will discuss them in the next video. So the other classification we will discuss here are penicillin, aminoglycoside, monobacterns, carbapenems, and macrolides. Also, there is another category which is comes in the other category, which are vancomycin, rifamycin. So first we come to the penicillin. Penicillins have three major types. So, first is natural penicillin. Natural penicillins are obtained from natural sources like fungi, Penicillium chrysogenum. So in natural penicillins are penicillin G and penicillin 5. Due to their enormous amount of use, they become resistant against bacteria become resistant against these drugs. So we will use the other category, which is penicillin resistant drugs. Penicillin resistant drugs are effective against those bacteria which become resistant, which become superbug. So methicillin, neficillin, oxacillin, and others. Some drugs don't come in oral forms; they comes in injection forms, such as intramuscular injections, because their dose is effective only in intravenous or intramuscular. In oral, their bioavailability and effectiveness becomes very low. So the third type is aminopenicillin. Aminopenicillins are those penicillins which have amino group in them. So according to the structure, we will discuss when we discuss about penicillin in the next video. I will show you the structure of penicillin in which the amino group is attached to the penicillin, and that's why they become other drugs in the third category. So in aminopenicillin we got ampicillin, we also got amoxicillin. These drugs are effective against methicillin resistant Staphylococcus aureus and other drugs. These drugs are effective also against bacteria that are resistant nowadays. So The other category we will discuss here is aminoglycosides. Aminoglycosides, in which there are 5 drugs: amikacin, gentamicin, kanamycin, neomycin, tropomycin. Remember, the last 3 drugs have mycin in their names. So, not to be confused, these mycin with the other mycins of macrolides and in the other group drug category. These first 2 drugs, we can easily remember them as seen in their structure. So, in aminoglycoside, there are 5 major drugs: amikacin, gentamicin, kanamycin, neomycin, and topramycin. The other third category is monobacterns. Monobacterns we have only one drug, which is aztreonam, and we can easily remember it. The fourth category is carbapenems. In carbapenems, we can remember that this penem on nems will occur in their last abbreviation. We will easily remember as this prefix. So, iminenem, atrapenem, and meropenem. These 3 drugs, all these 3 drugs have nems in their name, so we can easily remember it. The fourth category is the fifth category is macrolides. Macrolides, these macrolides have 4 major drugs as azithromycin, clarithromycin, erythromycin, and clindamycin. All that have their prefix mycin in them, so we can easily remember it, but not to be confused with these 3 drugs. These are the exceptional cases, so we cannot confuse it with macrolides, or we can put aminoglycosides macrolides. That's not possible. And in the others, we will discuss these drugs in the next video. You can see there is a drug named vancomycin. You can see this mycin. These are the exceptional case, not to be confused with macrolides and aminoglycosides. These are the other drugs, have different structure, they have different chemical structure and perform different types of mechanism through which they kill bacteria: rifampicin, doxycycline, lanzolate, tetracycline, trimethoprim, and sulfamethoxazole. So guys, these are the antibiotics classification and the mechanism of these drugs we will discuss in the next video. And I also will show you how to remember fluoroquinolones and cephalosporin through mnemonics